Hello, good evening. Thank you for joining us, Migraine Ontario. This is Heba Hani. I'm joined today by Lauren Wooten and Natanya Mandel, and we are very happy to be spending this evening with you to talk about vestibular migraine. It is Migraine Awareness Month. Thank you very much for joining us, and thank you for spreading awareness around migraine. I will start by introducing Lauren Wooten, who will start this evening to talk to us about physical therapy and vestibular migraine. So Lauren completed her Masters of Science at Ontario McMaster University in 2012. She is the founder of the Vertigo Therapist and has developed an effective method of assessment and treatment of vestibular conditions using virtual appointments and various technology. Us at Migraine Ontario, we thought this is a great opportunity for our members to have the opportunity to connect with someone. Ontario is huge, so this virtual possibility is something that all three of us bring to our members, and it might be a great idea for you to consider this to complement your treatment journey. She has, as I said, a virtual practice, and she's able to reach people in remote and rural areas of Ontario who are searching for relief from their vestibular symptoms. Welcome, Lauren. Thank you for joining us tonight. Um, we are very happy to have you here, and we will start with you tonight, if you don't mind.
Great. Thank you, Heba. Thanks so much for having me. This is a really exciting opportunity to meet people across Ontario. I often talk to people kind of everywhere, but to have just Ontario is a really exciting opportunity because my practice is only in Ontario. So if you know people elsewhere out of Ontario, it's we can only treat within Ontario due to our regulations. So this is great. So for the presentation today, we're going to be chatting about vestibular migraine. Heather did a great introduction, so I don't need to introduce myself too much more. But Heather, actually, I didn't ask you, how do I switch the slides, or am I going to have to ask you to do that?
I can switch for you.
Okay.
One thing, I'm still hearing a clicking. So if our viewers are hearing the clicking, please let us know in the chat, and we'll be more than happy to stop, try and find out where it's coming from. It's no longer there, but if you do have issues with the sound, please let us know. So I can start with
That's perfect.
this.
Great.
Perfect.
So what we're going to talk about today is talking about the difference between vertigo and dizziness, because there is a little bit of a difference. What is a vestibular migraine? Who gets the vestibular migraines? What are some disorders that are similar to vestibular migraine or sometimes happen in conjunction with it? And then how can vestibular therapy help with vestibular migraine? We'll go to the next slide. Perfect. Okay. So vertigo versus dizziness. Vertigo is defined is an illusion of motion. So you either feel yourself moving or you feel your environment moving. It doesn't have to be a spinning sensation. It's just some sort of movement. Often it is a spinning, or it can feel like a falling, a tumbling, a bobbing, floating is a common one. And those types of, shifting and that kind of thing. You feel like you're moving or the world around you is moving when it's not. And then dizziness is a non-specific disorientation. So there's not really an illusion of motion. It's more of a general and broad term that encompasses feelings like disorientated, lightheaded, discombobulated. It's a little bit more vague. It often feels people just have a hard time explaining it usually, and it's just a feeling of feeling off or feeling as if things are not right. So we can skip to the next slide. This is a post from my Instagram account that I made a while back, but it's a good reminder of the impact and the sort of vastness of vestibular migraine. So if they say that on approximately 10% of the human population has migraine, and 20% of women that are childbearing age have migraine, and then 1 in 3 people with migraine experience vestibular symptoms. So if you think about that 10% of people that has migraine, 1 in 3 of those is going to have vestibular symptoms. So that's quite a bit. So vestibular migraine is an extremely prevalent, we're skipping ahead there, prevalent condition, but it's really under-recognized, underdiagnosed, and needs a lot more awareness. So what is vestibular migraine? It is a migraine with predominantly vertigo and dizziness. So a lot of people have a typical migraine and they may get a bit of dizziness with it. That's not a vestibular migraine. A vestibular migraine has to be the vertigo and dizziness is what's making you, it is the disabling kind of symptom. This is something that a lot of people don't realize, but headaches may or may not accompany your vestibular migraine. You may only have vertigo and dizziness, or one or the other, and that's your only symptom. And it's this attack of vertigo that lasts a few hours, and you don't know where it came from or what's happening. You go to the ER or whatever the first time it happens, and it's not diagnosed properly because you never mentioned headache, and the doctors wouldn't necessarily go to the migraine diagnosis if you're not having that headache, but it does not need to be there. It can be episodic or chronic, and it may have interictal symptoms. So that sort of between attacks, you may continue to have that low level of dizziness, and that's why some people don't think migraine either, is that you're not having attacks where you're fine in between. You have sort of these peaks and valleys of good days and bad days, and it's a little bit different that way. So something to think about is that a migraine has a neurological origin, and it's causing a physical symptom elsewhere in the body. So it's coming from your brain and it's giving you some sort of symptom. One of those symptoms could be vertigo. Sometimes it's visual symptoms. Sometimes it's stomach issues. So it doesn't have to be a headache. So we can move on to the next. Triggers. A lot of triggers are similar to lots of other types of migraines, but some of the more common ones for vestibular migraine would be head movement. So if you're at, let's say, a soccer game and you're looking back and forth all day, or you're out for dinner and you're looking at the person to your left and the person to your right, so all of that head movement can really trigger that vestibular migraine. Motion-rich environments. So if you're somewhere like a amusement park, or somewhere where there's a lot of movement happening, that's another trigger. Grocery stores, just there's so many things to look at, so many colors, so many aisles and patterns. That's a common one. Screens and scrolling. So if you're spending a lot of time on your phone visually or in front of a screen. And then patterns, hormonal changes is another huge one that we'll talk about a little later. Sleep disturbances, stress, caffeine, etc. Now we can go on. So this is a little bit more of a kind of detailed medical diagnosis, but this is an important slide. So this is how a physician or neurologist would diagnose vestibular migraine. It is diagnosed when you've had at least 5 episodes of vestibular symptoms of moderate or severe intensity, and they have to last between 5 minutes and 72 hours. So it has to be within that range. You also have to have a current history or a previous history of migraine, with or without aura. And you have to have one or more migraine features with at least 50% of the episodes. So at least half of the episodes have to have a headache or photophobia and phonophobia. So that's the light sensitivity, sound sensitivity, or visual aura. So one of those 3 symptoms has to be present. So headache does not have to be present, but if you have light sensitivity and aura along with your vestibular symptoms, then it's likely vestibular migraine. The current or previous history of migraine category. So if you've never been diagnosed with migraine, but you're having these symptoms, that can be diagnosed as probable migraine, but it to be right now the diagnostic criteria, they're still trying to figure it out. It's still a little bit of a newer diagnosis, but right now you have to have that previous history.
I don't know if I can speak to this as well. I know that specifically vestibular migraine is one of the migraine types that is most difficult to diagnose, because most of the times, or most people don't even get a headache. So they might get all the vestibular symptoms. They are dizzy, they feel nauseated, they are very sensitive to light and sound, but they do not have a headache. So this is one of these conditions that stays, or that takes longest to actually get diagnosed, in comparison to other types of headaches or in migraine. And a lot of times it's diagnosed as sinus headache or Meniere disease, and it might take years. And you're absolutely right in terms of diagnostic criteria. I know that this is still something that they're working on, because they feel that the current diagnostic criteria is not making it easier to diagnose someone. So
Absolutely.
if some of our members feel that maybe I have this, but my doctor never told me I have it, it's possible that this is because a lot of people don't really know about it, or even your family doctor might not be able to diagnose it as easy, because that diagnostic criteria is not very clear. Sorry to interrupt you, but I
No,
couldn't
that's
stop
okay.
myself.
No, that's a good point for sure. Yeah, yeah. I totally agree with all of that. You can move on to the next one there, Heba. Okay, so who gets vestibular migraine? So we talked a little bit about it, but females are way more likely to get it than males. However, I have treated quite a few males with vestibular migraine as well. So it's in both genders, but more with females. Just like typical migraines, the genetic predisposition is strong. A lot of times I'll treat someone who says, they don't know they have vestibular migraine yet, but they'll tell me all their symptoms, and they'll say, my mother had this and my grandmother had this, and it's sort of a lineage that comes down, and you think, okay, if there's that genetic predisposition, then it is more likely the vestibular migraine that's causing all of it. But their mother and grandmother likely never got diagnosed properly. So other people that get vestibular migraine are people who have increased stress and traumatic events, depression, vitamin and nutrient deficiencies, hormonal changes. Very common, actually, post-pregnancy I see a lot, and then perimenopause a lot as well. And then concussions and brain injuries can make you more susceptible as well. It's often just like Heba was saying, yes, vestibular migraine is often misdiagnosed. You often have to go to 5-6 different health professional specialists and so on before you actually get a proper diagnosis. So some of the conditions that you may have been diagnosed with previously would be Meniere's disease. Has very similar symptoms to Meniere's disease. There's only a few little things that sort of set it apart. Perilymphatic fistula, that's an inner ear disease. Vestibular neuritis, BPPV. A lot of people will get diagnosed with BPPV. Going to the emerge with vertigo, you get diagnosed with BPPV most of the time. Ear infections, as Heba said, sinus problems, and then anxiety or panic attacks. People say, it's just your anxiety, which it's not. Then on the other side of the slide here, you see that vestibular migraine can occur at the same time as these conditions. So people with vestibular migraine can also have BPPV. So if you have vestibular migraine episodes, and then one day, you're having this positional vertigo. BPPV stands for benign paroxysmal positional vertigo, and it's usually characterized by a strong vertigo sensation that only lasts a minute or two. So that makes it different than vestibular migraine. The vertigo is a spinning sensation, lasts 1 minute, and it's usually with a big head position change. So usually when you go to roll in bed or go to sit up in the morning, you'll feel that, and that can occur. People with migraine, any type of migraine, are more likely to get BPPV. PPPD, or triple PD, persistent postural perceptual disorder, occurs simultaneously with vestibular migraine often as well. Quite a few people that I've treated have both, and so that's sort of that interictal low-level dizziness that you have daily, along with visual vertigo and kind of motion sensitivity and all that is kind of a constant symptom. And then you'll have these random attacks of heightened symptoms, which are the vestibular migraine, but the PPPD and VM can go together. Maladie-Debarkman syndrome, that's the one where you have like you don't lose your sea legs. You get off a ship, a cruise ship or something like that, and you feel like you're still on the boat for months. So that's a really difficult syndrome to treat, and people with vestibular migraine or history of migraine are more likely to encounter this disorder as well. And then anxiety and depression commonly go along with vestibular migraine. I would say in my practice, the people that I treat with vestibular migraine, I would say about 80% of them have an associated pretty strong anxiety as well. And it's not that anxiety causes vestibular migraine or vestibular migraine causes anxiety. They just have this sort of vicious circle where they feed each other. And so they are very closely linked, and we have to work kind of on both sides of it a lot of the time. We can move on to the next there. So what can I do to help vestibular migraine? What does a vestibular therapist do? So I'm a physiotherapist in training, but in the past couple of years, well, for several years now, since I think about 2016, I've been treating vestibular conditions, and I love it. It's so rewarding to help people who have been suffering and searching for help for such a long time. It's an area where there's not a lot of health professionals that specialize in it, and so when someone finds a health professional who kind of understands, we can really do a lot for them. So we can move to the next slide. So what we do as vestibular physiotherapists, or we do exercises, but we do a lot more. So we are exercise specialists. In the exercise realm, we come up with an individualized program that's specific to your situation, based on a pretty thorough assessment that we do. And it can contain a combination of the following things, such as habituation exercises. So that's trying to get you accustomed to certain movements that you've either been afraid of or are triggers for you, or those types of things. We ease them back in, and your brain can actually adapt to being able to do those things again through specific exercises. Lots of visual exercises, because visual, like we said, the visual sensitivity to motion and things like that. We can do a lot of visual exercises for that. Lots of balance exercises. Find with my migraine patients lots of neck exercises for strengthening and stretching, and for posture. And then I end up doing a lot of, because of the anxiety and the stress and all that, we end up doing a lot of relaxation exercises as well, to try to just calm down that overactive nervous system. Lots of education. So I'm probably preaching to the choir here in a group about that. This group that I'm talking to. A lot of you probably have already educated yourself quite a bit on these topics, but some people have no idea. And I do a lot of education for everyone. And then again, you guys may be aware of these, but there are lots of lifestyle changes and triggers that some people aren't aware of, diet changes, etc., that can help with reducing your attacks and the length of your attacks and the severity of them. The other thing I like to do is help people find physical activity that's tolerable and appropriate for them. So, you always hear exercise helps migraine, but everybody knows that, but you may not know what's appropriate for you. And, if you do too much, you're going to make things worse. And if you don't do enough, then it's not going to be helpful. So we try to find something that's enjoyable for you, and something that you enjoy doing, something that's going to work as sort of a long-term thing for you, and then find a way to adapt it into your schedule. And then having a vestibular therapist working with you is going to, you're paying for a service, or your benefits are paying for it. You have scheduled appointments, so it's going to make you more accountable to sticking to a routine. If there's a kind of a professional kind of checking in with you every so often. We also can help to refer and set up appointments with other health professionals. So we have, a network of people that work with people with dizziness that we can help you get hooked up with. And then we do advocate to your family doctor or specialist. We'll write letters, we'll make phone calls, make recommendations to them, because we often see you a lot more than your doctors will. We start off usually with a once weekly appointment, moving on to spreading them out as things improve. So we get to know you quite well, and we can help to send information to those other professionals to advocate for you. We can move on. So now we're going to try an exercise, one that I will give to a lot of my patients with vestibular migraine. And I would love if all of you could try this, as long as you feel safe doing this balance exercise. I'm going to demonstrate here. Let me stand up. So if you have a safe place to stand up, and if you're at a desk or a countertop or somewhere where you have something to hold on to, even your kind of the back of your chair or something like that, you're just going to stand up and you're going to put your feet, so have something close by to hold on to, but put your feet right side by side to touch. So I want your 2 feet touching, and I want you to stand up nice and tall. Okay, just put your hands close to something, but try not to touch anything at this point. Just hold your balance there. So that's your number one balance exercise. That shouldn't be too challenging for the general population. Now what I want you to do is actually close your eyes and see if your balance feels any different. So I feel my feet working a little bit harder and kind of wavering front and back just a tiny little bit. If you have to touch down onto something or step, that means that your vestibular system is not very strong. So it means that you're relying more on your vision for balance than you should be. So when we rely on our vision, we can go back to the slideshow there. When we rely on our vision for balance, we're not listening to our vestibular system. Your brain sort of turns off parts of your vestibular system because it is trying to focus on objects and things in that it can see to help with feeling steady, instead of listening to the vestibular system because it doesn't trust it anymore. So that exercise can actually help to kind of turn that vestibular system and have your brain listen in a little bit more to that inner ear vestibular system than it's used to, and rely less on the vision, because when we rely too much on vision, our vision, that's where we get overstimulated. Our visual system can get overstimulated and get symptoms.
I don't know if I can ask you this question. So how often do we need to do these
Yeah.
exercises? Like how many times a day?
Yeah. So generally, so it would have to be sort of prescribed specifically to the person, but in general, that one I would usually prescribe to doing that at least once a day. So holding for 10 seconds with the eyes closed and do 3 repetitions in a row, once a day, every day if we can. But it's not a huge commitment. You know, I might give 3 or 4 exercises to do once a day for these types of exercises.
And that would be enough for someone to see a difference? And how long does it take usually if you start these exercises? Usually, how long does it take for someone
Yeah.
to see a difference or an improvement?
Yeah. So for this exercise, it would this is to help with your balance and kind of inner ear vestibular system awareness. So it would probably take, within a couple of weeks, if you're doing it consistent, you're definitely going to see a difference in your ability to do the exercise. And then in terms of symptoms and helping with your symptoms, there'd have to be a lot more than just that one exercise. It would be a whole kind of treatment program. But usually my patients see after starting vestibular therapy if they're doing well with their program, within 3 to 6 weeks, some improvement.
Perfect. Thank you.
You're welcome. We can go to the next. So how does virtual therapy work? So like Heba had said earlier, the vertigo therapist is completely virtual. So I do and my colleague, we treat patients in their own homes over video conference. So the great thing about that is that you're doing the work at home. It's where you're going to be doing your exercises anyways. So it's a great environment to learn the exercises. You're doing all the work. I'm not putting my hands on you. I'm not, doing acupuncture or manipulations or things like that are something doing to you. You are doing all of the things that are going to help here. So that's the bonus of that. It's also really great for people who aren't able to drive, willing to drive a long distance to find a good vestibular therapist. Some people have busy schedules and would rather just, get it done while they're at the office or things like that. And then, of course, people who live in rural areas, so where there's not a good vestibular therapist available, there aren't a lot of us in Ontario, and the ones that are in Ontario are usually centered in kind of major cities. So if you're outside of a major city, then you may not be able to find a decent vestibular therapist. And I find a lot of there are lots of great vestibular therapists out there, but it's hard to find the ones that have that advanced training. There is, they may have only done the weekend course and they still advertise that they do all kinds of physiotherapy, and vestibular being one of them, but they may only know kind of the basics. So you want to really, if you are going to start with this, you want to do your research and find someone who's really kind of hones in and specializes in, maybe it's not a fully vestibular therapy clinic, but at least, neurological, or a lot of the concussion and brain injury type of clinics will have vestibular in there as well. So making sure you're finding a therapist who's really well versed in it, because like we said, vestibular migraine is a challenging one to treat. So you want to have someone really good. And yeah, lots of email support, for my virtual clients and so on. So next slide. So you can reach us at thevertigotherapist.com. You can, right from that website, set up a free phone consultation if you had any more questions that you wanted to ask, or see if your situation would work. And you can book your assessments online as well, or shoot me an email. I love getting emails and just chatting through email to answer any questions or anything like that. We have Facebook and Instagram that you can follow us on. And that's my colleague Zoe in the picture there as well. So both of us are the virtual therapists with the Vertigo Therapist. So thanks so much for listening. Should I answer questions now, or are there questions in the chat that I should answer, or what should we do?
So I can see one question here, and that is, what foods would you say we should avoid? I have already given up coffee and don't drink much alcohol. Can you answer this one, Lauren?
Sure, yeah. So that's great. That's one of the first things that I say is caffeine is a really huge trigger that I find, alcohol and red wine and that kind of stuff. So you're already on the right track there. Increasing water is another big one. So just making sure you're drinking lots and lots of water every day. Another one that I've read that is a pretty big trigger is sort of any sort of artificial seasonings like MSG or those sort of flavorings kind of thing can be a big one. Trying to think of what are the other big. Oh, chocolate, maybe because of the caffeine in it, but also just the chocolate itself could be a pretty big trigger. Sometimes what I'll do is I'll refer people to the book called Heal Your Headache, which some of you may have heard of if you want to go a little bit deeper into the foods. And there's also a website called The Dizzy Cook. It's thedizzycook.com, and she has some really great food information and recipes and whatnot specifically for vestibular migraine. And she has a whole list, and I'll usually just send people the list of foods that she recommends that you cut out.
I love the recipes that the Dizzy Cook also puts. They're really easy to do and very straightforward, and you can understand the logic. Now, I will chime in here, and I will say that this is still migraine. So all the triggers for migraine might be triggers for vestibular migraine. So we are going to say definitely you need a diet that is high in omega-3 and low in omega-6. Omega-3 is an anti-inflammatory, is anti-inflammatory, while omega-6. So omega-3 is something like fatty fish, even olive oil, and anything that's fried that is too processed is something that is definitely to be avoided for anybody who's living with migraine. There is an inflammatory part to vestibular migraine and to migraine, and this is one of the things. This is one of the things you can do. But also MSG, you said, absolutely, sugar. We should avoid sugar for sure. We should have high protein diet and best to have the highest protein as early in the day as possible. Of course, alcohol does affect your balance, so you're doing great by avoiding alcohol. Natanya, it looks like you also have some advice to our listeners or to our viewers today.
Oh, yeah. So yeah, I was going to say what you were going to say, which is the sugars, carbohydrate type sugars as well, like thinking outside the box with what the sugars are. So not just the sugar that you add to your tea or coffee, but yeah, and adding things like legumes and those other long acting, keeping your sugar levels even. And I think that's for all types of migraine, but particularly vestibular migraine is really helpful to try and keep your body on an even keel throughout the day, rather than getting hungry and your sugar levels drop and then eating possibly the types of foods that make your sugars go really high, and then that throws our hypersensitive bodies out of whack a little. So yeah, those things, those watching out for those types of activities can really help. We have another question here too around, is there any medicine to help with dizziness, in the chat?
Yeah, I'm going to refer that to Heba because she's our pharmacist.
Yeah.
So yes, we do have a few medications that can help. Um, Interestingly enough, the treatment for vestibular migraine, again, there are the same medicines that we use to manage migraine. Um, we're looking, I don't know if you remember, if you've attended any of the other events, then we have first line, our beta blockers and tricyclic antidepressants. So we're talking about propranolol, metoprolol. We're talking about amitriptyline, nortriptyline. With second line, our candesartan, which is another medication used for blood pressure. We're talking about Topimax. A lot of our patients or a lot of our members have tried or are on topiramate. We're talking about if you have chronic migraine, then, of course, Botox is one of these medications. We're talking about CGRPs, the injectables, the self-injectables that are available now, the monthly injections, and very soon we're going to have the infusion. So there are a lot of medications that are currently indicated for the treatment. And once you help with the migraine itself, it might have an impact on dizziness. But a medication that only works on dizziness, it's beta-histine. I don't know if you have experience with beta-histine. It does help with the dizziness. Sometimes I get people saying, well, it helps with dizziness, but it gives me nausea and vomiting. I cannot tolerate it. So one of the things we need to do is, for sure, start with a lower dose, use it, and try to titrate it up slowly. If you feel it upsets your stomach, take it with food. And if you feel that you need to protect your stomach or to take something for the nausea might be a symptom that is separate, and that if you add also anti-nauseant might help also with the dizziness a little bit.
I'll
Does this
just
answer
add,
your question?
yeah, I'll add to that about the beta histine. So a lot of people will be prescribed that. It goes by Circ as well, right?
Yes.
A lot of people will be prescribed that in the ER or by their family doctor when they first go in with dizziness or vertigo. And so most of my patients as well have been on it at some point or another. But what I've learned is that it's a vestibular suppressant, so it sort of reduces your ability to feel dizziness and vertigo. But if you're trying to do vestibular rehabilitation, it's actually not advised that you're on anything like that, because you won't be able to do the exercises as well. Your brain won't be able to kind of listen back to your vestibular system enough to make any changes. So it's a good first line of defense. But if you're trying to rehabilitate and improve your own sort of compensation in your brain, then it's better to try to come off of it.
Yes, and again, it's the idea is that you need to manage migraine. So, and vestibular migraine is a type of migraine. So the best thing would be to prevent migraine from happening. And again, just because you don't have the headache, it doesn't mean that you will not benefit from a migraine treatment or a
Mm-hmm.
headache. Does that make sense?
Yeah. I have another question for Lauren here
Mm-hmm.
from earlier in the week. Hang on, I'm just trying to find it. Sometimes my vertigo gets triggered by walking on uneven ground or by being on a boat. Well, I don't know if it's for you or if it's for Heba actually. Is there an OTC medication to help with that?
So I'll say, medication wise, we can let Heba answer that. But if you don't want to go the medication route or would rather do some therapy, there's certainly some things that vestibular therapy wise that can help with sensitivity to uneven ground and boat type stuff. So that would be kind of the habituation and balance exercises that we would do to address that. So there's certainly things we can do there with a therapist.
So I would chime in that yes, I'm the pharmacist and I know medicine, but I'm always for longer lasting solutions. And I think in this case, exercises and habituation and trying to get proper therapy for your condition is longer lasting and doesn't have side effects as well. So even if these medications are available or over the counter, doesn't mean that they don't come with their own set of side effects. So I would say I would rather you go through physiotherapy first, and any medication that might help a little bit. So there are medications or there are over-the-counter solutions that are available, but I wouldn't go there. I would start with physiotherapy.
Okay.
Okay. So Natanya, I'm going to ask you a question. I know you want to answer the questions we got. I know that you live with vestibular migraine.
Yeah.
So I don't know if you want to first tell us, I mean, I can start by introducing you at this point of time. I know that a lot of the members know you, but I know that you've switched careers. You started with the not-for-profit um, um, uh, sector, and then you started, or I don't know, how long have you been living with migraine or with vestibular? Was it only vestibular migraine, or is it more than one type? Tell us a little bit about your condition.
Okay. So yeah, sure. So I basically was diagnosed with migraine when I was 5 years old with what they called back then classic migraine, so migraine with aura. And so I've always had migraine. And then when I was 41, one day I just got dizzy. And I ended up in hospital, and it was pretty awful. I was dizzy 24/7 for months, and I was bedridden, and it was I mean, I think quite a few of our members can probably relate to this. It was pretty hideous. Anyway, eventually, after lots of space age testing, this was in Sydney, at the Dizzy Clinic, I was diagnosed with vestibular migraine. And anyway, I had, since I got to Ontario or Toronto, I live in Toronto, I rejigged my career, and now I work as a coach, and I specialize in migraine, working with people with migraine, and I have learned more and more about my own condition, and about migraine, and of course about vestibular migraine, because really that's impacted how I work and how much I work, and also my own approach to looking after my body and respecting my own boundaries. And I learned that a lot of the symptoms that I had were actually symptoms of vestibular migraine, but without the dizzy. So, there's all these neurological symptoms that I have that I always just thought were really normal, that everybody experienced them, but nobody else really experienced them
Like what?
necessarily. Like Alice in Wonderland syndrome, or when you close your eyes, you see shapes and spots and lights and things for quite a long time, but other people don't necessarily see that. Other people with migraine might see it, but not everybody gets that. Like I asked my husband, I read it in a book, and I'm like, oh, I said to my husband, oh, do you get that? He's like, no, that's weird. So there are a few other things like that I experienced. My first sign that I'm getting a migraine attack has always been a loss of depth perception, which I always thought was pretty normal and like aura. And then I've been told, no, that's not aura, that's something else. And so so it's been a really good learning for me to learn more about my condition and to learn what the different symptoms and things are. And yeah, so that's really my story about my migraine journey, or the simple quick version of my migraine journey. So I have really migraine with aura. I do get aura, and also I have vestibular migraine, which when I get it lasts for months. Like the dizzy lasts for months and months. But I
And
have
have
the
you had
others.
an experience with a physiotherapist? Have you tried physiotherapy? Tell us your experience, and we will ask also Lauren to chime in about what having virtual access, how it would have helped, or it would help more people to actually have access to this.
Yeah, so unfortunately, I didn't have access to a vestibular therapist until much more recently. But my last experience of vestibular, dizziness, I guess, I did, and I had to go. Down, I guess, downtown a bit to get to somebody. So it wasn't all that convenient. And of course, when you're dizzy, you can't drive because you might kill somebody. And so my husband had to take me, which was terribly inconvenient for everybody. And or I would have to Uber or something. And the therapist was awesome. Like he knew so much about vestibular migraine and about other types of vestibular conditions, and he was able to give me exercises. But for me, I would have to say, and it did help, like the different exercises and the exercises he gave me at home. And one of the really great things that he did was making sure that I didn't overwork, because he was keen that I didn't trigger more attacks, because with VM, like, it's not going to go away. And so he was keen that it was slow and steady improvement, rather than anything else. And so he was very respectful. But the biggest thing, I think, for me was having to go travel somewhere to get to the vestibular therapist, when that's pretty unrealistic when you're having a vestibular attack, and you can't sometimes you can't even walk. Like, it's just totally unrealistic to even walk somewhere, let alone drive somewhere. So that, I think, that was the biggest thing for me, was that I had to rely on somebody else to get me there. And what happens if you don't have somebody else to get you there? Or you don't have a car, or you're low income, or any of those issues. So we're relatively privileged, so we were okay, but other people are not. So yeah, so I think that's really was where I sort of think a little beyond my own circumstance with that access issue, and why I think it's so awesome, Lauren, that you're a virtual practitioner. So
yeah. So I think the pandemic has really helped in that sense that, if I had started this business years ago, we had the capability, but I think people would have been a lot more leery of virtual treatment. Whereas now I think, most people have tried Zoom calls and this and that, even with their family doctor or friends or whatever it is, and it's not as complicated as it may seem. So even, you know, today I treated an 81-year-old man, you know, no problem. He was perfect on it. So any age, any, you know, even income level, you know, as long as you have some sort of a screen, you can participate in it.
Mm.
And
Yeah.
the thing is, Natania was lucky to have a support system where someone could drive her. The timing was okay. They could do it at the time or whatever. But that is not something that we take for granted. But with our patients or with people living
Mhm.
with these conditions, it doesn't mean that they will always be available at the right time, on the right day, and be able to do things for us or our support system does not always come through. And it's a great opportunity for us to leverage. As you said, the technology, a long time ago, it was only those who had this cool computer with, like, but now my mom has an iPad, which she has her phone. She can do everything. And the age, or as you said, socioeconomic, or where you live or whatever, as long as you have a connection, um, for even a phone is enough for, like, can people do it if they only have a phone, or do they need a big screen? Lauren, what do you think?
I've treated people just with their phones before. And actually, I just saw another question come in saying, I can't walk, let alone stand or sit up when the attack happens. So that's that's not, hi, Judy. Um, that's not when we would want to be doing a session either. We want to wait. You know, there's not a lot. I mean, there are certainly some tips that I could give you for that specific moment, but I don't want to go through a 30-minute or an hour session with someone when they're in the middle of an attack. We're definitely going to let things settle down for a few days on its own before we do some treatment. So sometimes I'll send emails or even just a quick phone call to someone who, a lot of times actually it's the spouse that'll email me and say, my wife's having this terrible attack. What kind of, you know, what can you do to help her? So usually it's here's a few tips and tricks, and then, you know, we'll follow up in a few days when things have settled. So yeah, that's how it works.
Perfect.
Mm.
I'm going to introduce Natania again. And Natania, you've switched from being someone living with migraine to someone supporting others who live with migraine. So can you tell us, what is it that a migraine coach does and what kind of support they can expect from you?
Okay, I'll be quite brief, but yes. So my background is in the nonprofit sector. As I started out as a crisis counsellor, and then I worked my way up in the nonprofit sector and charities, working with charities, to working in as, you know, the CEO and etc. and on boards, and then when we moved to Toronto about 5 years ago, I decided I didn't you know, that career wasn't really working for me with migraine anymore, and I really wanted to refocus and get back to working just directly with people. And so I retrained as a coach because I couldn't work as a counsellor here. And after, I guess, doing quite a lot of voluntary work with various organizations, I decided that, and, you know, adminning, you know, co-moderating Migraine Ontario, and, you know, doing other work, I decided that I really wanted to work with people with migraine. It was something that had obviously really impacted my life, my whole life and my career, and how effective I felt that I'd been in my career and my relationships and my health. And so that's what I've focused on. And so how I help people is I work with people on the things that I partner with people to work on the things that you can do yourself to improve your day-to-day life, to take more control. So it is, I guess, those lifestyle factors, which personally I don't like that term. I think it's used against people with migraine, but I'm not really sure what else to call them. But it's about what works for you. Lauren mentioned before about exercise. So it's about, for example, exploring what exercise works for you, talking about all the different types of seeds, things, education on on advocacy and how to advocate for yourself. We do mindfulness activities and sometimes meditation and anxiety management, and look at comorbidities. And I really partner with you and hold your hand through the process of managing your condition, your disorder, so that you can reduce your attacks and reduce the severity of your attacks, and work together with your healthcare team, and also look at other types of therapies that might work for you. So it could be working with somebody like Lauren, or other types of therapies. There's lots of different types of therapies and therapists out there that can make a difference for people with migraine disorder and other headache disorders.
Thank you very much, Natanya. And migraine is one of these conditions that does require a lot of support. It cannot be managed by one specialist or one healthcare professional. I'm going to use the old, it takes a village, basically, and we are your village. So between physiotherapy, between support, between medication advice and lifestyle advice, you might be able to get the support system from those who know best, or those who have the knowledge and the willingness as well to help you. We have 10 minutes left, so I'm going to just do a quick introduction, since this is for Migraine Ontario. So it is for those living in Ontario, and I'm going to just show them and talk to them about the Migraine Pharmacy Network that I am a part of. And the Migraine Pharmacy Network is a network that we have created in Ontario. We have trained pharmacists that actually help those who are diagnosed with migraine headaches. The network has been divided. The way that we have designed the program is at no charge to you. So if you live in Ontario, you can definitely book an appointment with us and see one of these pharmacists that are additionally trained to manage migraine. And we have designed the program in collaboration with Canadian Headache Specialists, with the Canadian Headache Society. We work with Migraine Canada, and we have family physicians, we have pharmacists, we have physiotherapists, and we have nurses who have given us input into how to best support people who are living with migraine at the pharmacy level. Again, it's free, it's easy to use. You can either go to a pharmacy near you that is enrolled in the program, or has a pharmacist that is enrolled in the program and trained by the program, or you can get virtual care. Ontario is free, and it's to find a pharmacist. As I said, you can either find someone in an actual pharmacy near you, and to do this, you can go to Migraine Canada, click on posts. If you can see the posts there, and then on news, and you will find the Migraine Pharmacy Network, and you can see when you click, I don't know if you can see the highlighted clicking here, it will generate a list with contact numbers for people who are close to you. Alternatively, you can go to well.ca/migraine, and when you go there, you will see this page. Go there and just get started, and you will be able to get an appointment that is virtual. They will send you a link, and you will be able to book an appointment. You will find me there if you need an appointment that is with me. That's where I provide my service through the Migraine Pharmacy Network. And that is in collaboration, again, with well.ca, and it's at no charge for you. It is a 1 hour consult, and I'm going to show you now what is it that you get from this consult. You get a detailed treatment plan that we share with your family doctor. So we go over your medications, current medications, how they work for you. We also look at what you used in the past, whether it is for acute treatment, so when you have an attack, or also if you are on a preventive, for us to give you advice on what you need to do so that you do not get a migraine attack. We also give you a personal care plan. So similar to what Natanya was talking about, we do the seeds, we look at your sleep, we look at your diet, we look at your exercise, we look at your stress, we look at everything that might be contributing to, I'm not going to say contributing, but what else can you do? What else can you change in your day-to-day life that might help you get the best out of your medications? And then we do provide a follow-up appointment to assess changes and adjust if needed, all at no charge. So if you get the first appointment within 3 months, you can contact the program again, and the program will be providing you with a follow-up appointment, and will be also making sure that whatever you were prescribed, if it's working for you, and if we need to adjust the dose, if we have to request from your doctor an alternative, and we follow up with you. So if this is something that you feel will help you, then please go ahead and book with a pharmacist that is trained to provide this service. So I'm going to just exit and go back to us. There we go. Perfect. If you have any questions, please put them in the chat. If I know that we had some, we still had some questions that came ahead. I know Natanya collected these questions ahead of our event. I don't know if Natanya, you still would like us to answer. We have 5 minutes that we can possibly answer some more questions.
Yeah. So, why do some medications seem to trigger vertigo as a side effect, and what is the best way to deal with it?
So, why do medications cause side effects has to do with how they work. So there's not always one. When they work, it's not always very specific in them just giving you the relief. They might be affecting other areas in your body that might give you side effects. So how do you deal with it? One of the things you can do is look at the dose with your doctor, have that discussion with your doctor around, is this the right dose for me? Can I go with a lower dose and then build up so that I build my tolerance? The other thing is, how am I taking it? When am I taking it? Is this the best time of day to take it? Is this do I take it with food or do I not take it with food? Am I taking any other medications that are making it more that does give me that side effect? So how to deal with it? To start with, we need to find out why it happens. Is it the dose? Is the dose too high? Is it that you are taking other medications that add up and cause that? And third is with time. Sometimes if you take something long enough, then it does after a while stop giving you, like your body starts to get used to it, and that side effect subsides with time.
Okay.
Lauren, you had something also to add, or no? Okay, sorry.
Okay.
No.
Thank you. And then next question is, there are so many types of magnesium. Which ones work best for migraine? And then a follow-up, would it be different for vestibular migraine?
It's not going to be different for vestibular migraine. The two that are recommended by Migraine Canada are magnesium citrate and magnesium glycinate. And to find out which one works best for you, the thing I always ask is, tell me about your bowel movement. Magnesium citrate causes diarrhea. So if you tend to have more constipation, and a lot of the people I work with who have migraine tend to have constipation, So if that is the case, then go for citrate. If you have a sensitive stomach and you have regular bowels, then we will go for the glycinate. A question I always have: what's the difference between glycinate and bisglycinate? They're exactly the same. Don't worry, they're exactly the same. And the dose that is required for people living with vestibular migraine or with migraine is again the same. It's 600 milligrams daily. Now, I do have we do have some indication that magnesium L-threonate is one of these types of magnesium that might help with cognition and that might help with brain fog, which is something that a lot of my patients seem to suffer with migraine. And that means that maybe there will be value. I find it very expensive. So sometimes I say, why don't you just combine it with magnesium citrate or glycinate and have one of if it's 600, take 100 of threonate and the rest take them from magnesium um, um, threonate. If you take it from threonate, take 100 and then take the rest from glycinate or citrate. See if that actually helps you, and then you can add, or if you can stay at that level. There are no real studies in migraine, but we know they have some indication that it might help in people who are having Alzheimer's and dementia, because it does cross the blood-brain barrier. So it's the only magnesium that actually crosses the blood-brain barrier.
Ah, interesting.
I have one question on the chat saying, what about things like nitrates? Natanya, do you want to take this one,
Um,
or do you want me to?
no, I'd like you to. Yeah.
Okay,
I mean, I have my view, but you're the.
So nitrates are by themselves vasodilators, which means that they actually relax the veins. And migraine is a dilation of the veins. So they might trigger a headache. So we do highly recommend you to um, uh, avoid things that have nitrates. So things that have nitrates are usually like smoked meat, processed hot dogs, cold cuts. All of these have high levels of nitrates, and they might trigger. There's nitrates. There's also sulfites that are in red wine, for instance, and they do exactly the same. They might trigger a headache or a migraine, and it might be the same for vestibular migraine. I don't know, Lauren, if this is something you would like to chime in, or you're.
No, I agree. Yeah, definitely nitrates are one that can be a trigger. Just all the processed meats and bacon, I think, is another one that has a lot of nitrates. So
Yeah.
I think we can
Nitrates
take one more
and
question.
nightshades as well can sometimes trigger for some people. So, are there any abortive meds that aren't triptans besides NSAIDs, Percocets, T3s, that sort of thing?
Yes. So the abortives are, to start with, triptans, NSAIDs, acetaminophen, which is Tylenol. But interestingly enough, antinosins sometimes can be abortives themselves. So there are some clinical trials on using an antinosient as an abortive, and they look like they could be helpful for some people living with migraine because of the way they work on certain receptors. The other thing is obviously the new ones that are still not here, and these are ditans and gpans, and these are available in the US. And the ditans are closer, or they are a little bit more like the triptans, but they're a little bit safer, but they cause more drowsiness. So something safer, but you cannot drive with them. I think they're controlled in some countries where they got registered. I don't know if they are coming to Canada. My understanding is that it's not going to happen soon. The ones that look like they're closer to coming to Canada are the gpans, and these are possibly, we're hoping that we will have them by the end of the year, or hopefully by the beginning of next year. And they're similar to the CGRPs, the injections, and they might they can be used as abortives or preventives, and there is one in the US that works for both. And again, we're hoping to get them beginning of the year.
Okay. Great.
Any other questions you want us to address, Natalia?
I have a question about devices. So, what devices are available and what's on the way? And what's good for kids, like teens, children? That's a big
So we know
question.
that there are some devices that are available now. So we know that in Canada we have Cephaly, and we do have also Gamma Core. Both can be used. There are some indications that they are helpful, and there are some, my understanding is that there are trials underway to show how useful they are. They are a little bit more, because they are not non-drug devices. They are um, they tend to be safer in teens, not really younger. They are helpful. Like the gamma core is used when someone might have, they are indicated in menstrual migraine. They have positive outcomes in vestibular migraine, and it is, these work by activating the gamma core, specifically works by activating the vagus nerve, and the vagus nerve is a nerve that comes all the way from your brain to your stomach, and it is they find that actually activating the vagus nerve might have an impact on migraine. Can be used as abortive. So that person who asked about what else, that could be used in the middle of a migraine attack, and can also be used to prevent by using it every day. And you might get the same benefit. Like, I was looking at some of the clinical trials, and when you look at it, migraine is one of these conditions where the placebo, so if you give a patient nothing, like a sugar pill, they have very good response rate. And I was currently attending the American Headache Society, and there was a whole thing about why do we have high placebo response in migraine. And one of the things is obviously the expectations are high. So when you prescribe something for someone, they expect it's going to work, and that seems to be higher in migraine than in other conditions. And when we looked at gamma core versus others, like the CGRPs, the numbers are not far off. So you can have a no drug treatment that actually does not have any of the side effects and might work well. Um, it is available in Canada. It is currently being sold in Canada, and I'm very happy to give you more information if you need specific information on these devices. There are other devices like the cuff that is available in the US. Again, we don't have that. There's a lot of devices that are available elsewhere that we do not have in Canada, and obviously we need to do a little bit more campaigning to say, hey, we are big enough, please come here, and we're very happy to have options and to bring options to people living with migraine.
Yeah, some advocacy work, definitely.
I think we went over time. I'm going to say thank you very much to Natanya and to Lauren for giving us this evening, and and of course we would like to thank Migraine Ontario for hosting this evening. Thank you very much. We hope that you've enjoyed this, and that this was informed, that provided you with information that was relevant, and we're looking forward to seeing you again in the near future. Thank you very much. Thanks, Lauren.
Thanks,
Thank you.
everybody.
Thank you, Heather.
Thanks,
Thanks,
Natalia.
Lauren.
Bye.
Have a
Bye.
very good evening.
You
You
too.
too.
Bye.